in children. An inguinal hernia occurs when a portion of the intestine protrudes through a weakened area in the abdominal wall, often extending into the groin region. This condition can affect individuals of all ages, including children. What is inguinal hernia in children? An inguinal hernia in children is a condition where part of the intestine or other abdominal tissue pushes through a weak spot in the inguinal canal, which is located in the groin area. This protrusion can cause a noticeable bulge and may lead to discomfort or pain. Causes of inguinal hernia in children. 1. Congenital weakness. Many inguinal hernias in children are present at birth due to a congenital weakness in the abdominal wall. This weakness can be attributed to the failure of the inguinal canal to close properly during fetal development. 2. Increased abdominal pressure. Although less common in infants, increased abdominal pressure due to activities like crying, coughing, or straining can contribute to the development of a hernia. Risk factors for inguinal hernia in children. 1. Premature birth. Premature infants are at a higher risk due to their underdeveloped abdominal wall and inguinal canal. 2. Family history. Children with a family history of hernias may be more likely to develop an inguinal hernia. 3. Gender. Boys are more commonly affected by inguinal hernias compared to girls, due to differences in the development of the groin area. 4. Genetic conditions. Certain genetic conditions or syndromes can increase the likelihood of developing an inguinal hernia. Symptoms of inguinal hernia in children. 1. Bulge in the groin. The most noticeable symptom is a bulge or swelling in the groin area, which may become more prominent when the child is crying, coughing, or straining. 2. Discomfort or pain. The bulge may cause discomfort or pain, particularly when pressure is applied or when the child is physically active. 3. Changes in activity. Some children may become more irritable or less active due to discomfort associated with the hernia. 4. Vomiting or constipation. In severe cases, if the hernia becomes incarcerated or strangulated, it may cause vomiting or constipation due to bowel obstruction. How is inguinal hernia diagnosed in children? 1. Physical examination. The initial diagnosis is often made through a physical examination. The doctor will check for the presence of a bulge in the groin area and may ask the child to cough or perform certain movements to assess the hernia. 2. Imaging tests. If needed, imaging tests such as an abdominal ultrasound may be used to confirm the presence and extent of the hernia. This helps in evaluating the hernia's impact on surrounding tissues and organs. 3. Medical history. The doctor may also review the child's medical history, including any symptoms or changes in behavior, to aid in the diagnosis. Treatment of inguinal hernia in children. 1. Surgical repair. The primary treatment for an inguinal hernia in children is surgical repair. The procedure, known as herniorrhaphy, involves pushing the protruding tissue back into the abdomen and repairing the weakened area of the abdominal wall. This surgery is typically performed under general anesthesia. 2. Monitoring. In some cases, if the hernia is small and asymptomatic, the doctor may choose to monitor the condition over time. However, surgery is generally recommended to prevent potential complications. 3. Postoperative care. After surgery, the child may need some time to recover. Postoperative care involves managing pain, ensuring proper wound healing, and gradually resuming normal activities. 4. Complications. Although rare, complications such as infection, recurrence of the hernia, or injury to surrounding tissues may occur. Regular follow-up with the healthcare provider ensures that any issues are promptly addressed. Summary. An inguinal hernia in children is a condition where part of the intestine protrudes through a weakened area in the abdominal wall, typically requiring surgical intervention for correction. Early diagnosis and treatment are important to prevent complications and ensure the child's well-being. If you notice symptoms of a hernia, consult a healthcare professional for an accurate diagnosis and appropriate treatment.